So if you want to see these thoracoabdominal nerves within the abdomen, you just have to remove, cut and reflect the external oblique. You still won't see it, you will see the internal oblique, so you'll have to cut and reflect the internal oblique, and then you'll see it. You'll see the thoracoabdominal nerves. You don't have to cut and reflect the transverse abdominis, because as you can see, if you cut this and reflect, and then you cut this and reflect both of these muscles, you will see the thoracoabdominal nerve lying on the surface of the transverse abdominis muscle. And likewise here, if you remove the anterior rectus sheath, you'll have to also remove, cut and reflect the rectus abdominis muscle to see this portion of the thoracoabdominal nerve. And you'll also, when you cut and reflect the rectus abdominis muscle, okay, so you reflect it like this, you will see these branches, these anterior cutaneous branches of the thoracoabdominal nerves attaching to the rectus abdominis muscle, like this here. So this is the rectus abdominis muscle. When you reflect it, there it is. You see the anterior cutaneous branches attaching to it. Okay, and this would be those thoracoabdominal nerves here. So here, these are the images from a book called the Color Atlas of Anatomy, a photograph study of the human body. Okay, and you see here, this is shows the muscles that I've already talked about. The rectus abdominis muscle coming all the way from the pubic bone all the way up here to the 5th costal cartilage, divided into by tendinous intersections into 1, 2, 3, 4 components. Then here's your external oblique, the aponeurosis, and then the rectus sheath. Okay, but the rectus is not shown here. And here, this is the external oblique. This would be your this is actually your transverse abdominis. They have removed the external oblique and the internal oblique, so showing the transverse abdominis. And as you can see, you can clearly see these thoracoabdominal nerves here running on top of the transverse abdominis and on top of the posterior rectus sheath. This is behind the rectus abdominis. That's the posterior rectus sheath. If you look closely, you see at the level of the arcuate line, the posterior rectus sheath, which is all of this white area here, stops. See, there's no more. And that's your transversalis fascia. So there's no more posterior rectus sheath below the arcuate line. So here, the same image shown here in real picture. So this is the rectus abdominis muscle, and when it is reflected, you can see the posterior rectus sheath, and this little arrow shows the arcuate line. So up here, below which the transversalis fascia, there's no more posterior rectus sheath. And this here is your this is actually your internal oblique. Okay, they have removed the external oblique, so you can see clearly that this is the internal oblique by the way they're oriented. And as you notice, as they approach the arcuate line, they become more horizontal, and then below the arcuate line, which is this arrow, they now face in the same down in this direction. Okay, so, and then this white area here, that's not the rectus sheath. It's not the rectus sheath because it's not covering the rectus abdominis. This is the aponeurosis of the external internal obliques in the transverse abdominis. This is the aponeurosis when the 3 membranes come together, and then they will form around the rectus abdominis to form the rectus sheath. And here, when you remove the internal oblique, you see the transverse abdominis, which is horizontally oriented, and right on this transverse abdominis you see the thoracoabdominal nerves as well as the vessels. We won't talk about the blood vessels now, but here are your thoracoabdominal nerves, and as you can see, they puncture through one of those membranes from the internal oblique to enter the space right behind the rectus abdominis. And in fact, once they are here, so this nerve coming, puncture through, and then it will come forward and attach to the rectus abdominis to pierce the rectus abdominis and protrude to the surface. So when you reflect the rectus abdominis, you'll see lots of these nerves holding it, attaching to it, these guys here, but they have been cut. So this also shows that when they do a surgery, they should not cut. So here, they should not make a cut along this side here, along the sides of the rectus abdominis, because all the nerves are coming in that area to attach to the rectus abdominis. All of these nerves, see how they come? So if you cut it here, you'll cut all of these nerves. You'll paralyze the rectus abdominis muscle.